Good afternoon to Palesa. 74 cases in the Free State so far, according to the NICD. What are we expecting the minister to say?
Well, good morning, Zenga. We are coming to you from Heidedal here in Bloemfontein. We are at a mall called Twin City Shopping Centre here in Bloemfontein, where mass screening will be happening, or rather it's already underway. It's about an hour into the mass screening process by the Department of Health here in the Free State. The minister will be coming through later today, and he will also give an update on the country's latest statistics that's as from today. But joining us right now is the Deputy Director in the Department of Health here in the Free State in primary health care, Dr West Tamalete, who's just going to take us through why this area, obviously it's linked to those church members that were found to have been infected by COVID-19. But just take us through, let's start with the process here today. How many people have been screened so far?
Good day. So far, people that are screened is 102 that are screened in this awareness and screening process that we are trying to embark. So it's 102 people that we have screened so far, but we have never, we don't have people who are referred for testing as yet. Yes.
Oh, I was made to understand earlier that about 3 people had been referred to Pilonomi. What was that for?
Basically, what they were trying to go and check is to check whether they might be a positive candidates or not. But when they were there, they were rechecked and checked again, and we found that it's just your basic flu. It's not really a COVID-19 criteria for them to be referred.
So would you say that the people that have been screened here today have got symptoms or not really?
Not really symptoms, because we are looking at potential contacts. We know that traveling is no longer a major issue. We are looking at potential contacts, and then we look at the other symptoms that they may have. But when we look at them, we find that it is only just your normal basic some flu symptom.
In our earlier discussion, you also mentioned that there were about 3 people in the area of was it phase 3 that had positively they're positively diagnosed with COVID-19. That's also one of the reasons that made you choose this particular area, because it's close to your phase 3. But just take us through other areas as well, in the contacts that you've said you've mapped.
Through our mapping system that we are doing, we're looking at that the contacts. When you look at the contacts, we find that people are scattered in different areas in terms of the contacts that we are trying to map, based on the positive cases that we are finding. So there are different areas that we are targeting. Starting today, we started with Heidedal. Here, Heidedal, we're looking at Opcoms, we're looking at Bloemfontein. And then we also did the other area, Masabi site, where we had some positive contacts that we believe that we can trace and try to find out we can have new cases from those areas. So we have made a plan now that is running up to the 16th of April, where we are going to go to different areas based on our mapping, and then try to check whether we can have new cases on those sites. Let me give a simple example. Tomorrow we are going to phase 3, and then we are also going to repeat again Kalabmasai. Over the weekend we will be doing Freedom Square and Saturday and Sunday. Just like that, Monday we will be doing Rocklands and those areas that we believe we might have contacts of people who might be moving around with COVID-19 at the same time. So that's what we are trying to do. And then this again, we are trying to do this also to try to make a massive awareness, so that our people out there are aware that they need to come forward and then screen themselves and test themselves. Yes.
Do you see people coming forward, or do you feel like people are still scared?
So far, people are coming forward. We're seeing a number of people are coming. Already we have embarked on the door-to-doors in other areas where some of our churches were affected. We are embarking on door-to-doors and trying to make sure that people are becoming aware of coming forward and test themselves, and screen themselves and test themselves. Yes.
Well, that is Ntate Westa Malete from the Department of Health here in the Free State, the Deputy Director of Primary Health Care. Later today, we will be joined by the Minister of Health, Dr Zwelini Mkhize. And like I said earlier, he will give a brief update on the latest statistics in the country. But also, I can also mention that currently he's in a meeting with the Provincial Department of Health officials as well as the MEC, also just to establish how many beds. Apparently, from our understanding earlier from the department, more beds have been made available for isolation purposes. That is now in National Hospital. Initially, the site that was allocated was Pelonomi Hospital, but as from today, more beds have been made available at the National Hospital here in Bloemfontein. But with that, it's back to you in studio.
Palesa Moeti giving us an update from Bloemfontein there. We'll cross to her a little bit later on.